If your eyes feel like sandpaper every single morning, burning, gritty, heavy, like someone pressed hot ash into them while you slept, then stop what you're doing, because the next 10 minutes might be the most important thing you watch this year, not because of anything dramatic, but because you're almost certainly treating the wrong problem. You've been told to use more eye drops, more artificial tears, more water, and you've probably been doing exactly that for months, maybe for years. And your eyes are still burning, still red, still ruining your mornings and exhausting your evenings. Here's the truth that most people with dry eyes are never told, in roughly 90% of cases. The problem is not that your eyes aren't making enough tears. The water is there. The problem is that your tears are evaporating off your tear eyes before they can do anything. There's a specific biological reason that happens, and there's a specific 5-minute ritual done right before bed that starts to reverse it, sometimes within the first 3 days. Stay with me, because this changes everything. Let me show you exactly what's happening inside your eye right now, because once you see it, the solution becomes obvious. When you blink, your eye spreads a thin protective layer across its surface. It's called the tear film. Most people assume that film is just water. It isn't. It's actually a 3-layer structure. Think of it like a very precise biological sandwich. The innermost layer is a mucus base that helps the whole film grip the eye. The middle layer is water, and the outermost layer, the one sitting right on top, exposed to air, is a thin, continuous coat of oil. That oil layer is the entire key to this problem. Its job is to act as a seal, a lid. It prevents the water underneath from evaporating into the air. Think of it like plastic wrap stretched over the surface of the eye. When that seal is intact, your tear film stays stable. Your eyes feel comfortable when it breaks down. The water underneath evaporates within 2 to 3 seconds of each blink. Your eye feels dry almost immediately, not because it isn't producing water, but because the water isn't being protected. Now, where does that oil come from? Along the edges of both your upper and lower eyelids, there are tiny oil-producing glands. They're called Meibomian glands, lined up like miniature wells just behind the lash line, roughly 30 to 40 in each eyelid. Every time you blink, these glands squeeze a warm, clear oil onto the surface of your tear film, replenishing that protective outer seal in real time. When these glands are healthy, your tear film is stable, your eyes feel comfortable, vision stays clear. But when these glands become blocked, when the oil inside them thickens from clear and fluid into something waxy and stiff, the glands can no longer express oil properly during a blink. The seal breaks down, the tear film evaporates, and you get the burning, the redness, that gritty sensation, blurry vision that gets worse in front of a screen. That strange feeling of something lodged in your eye when nothing is there, and waking up every morning with eyes that feel stiff, crusty, and on fire. This condition has a name. It's called Meibomian Gland Dysfunction, MGD. And according to data published in the journal Cornea, it is the underlying cause in approximately 86% of all dry eye disease cases. 86%. More than 8 out of 10 people suffering with chronic dry eyes have a problem with their oil glands, not their tear-producing glands. Yet the standard treatment almost everyone receives is artificial tears. Water-based drops for an oil-based problem. That is why the drops don't last. They're adding water to a system that cannot hold water, and because the protective oil layer is gone. It's not just ineffective, it's treating the wrong layer entirely. And you deserve to know that. Now here is the part I want you to lock in, because this is what makes the 5-minute bedtime ritual work at the biological level, not just temporarily. Meibom, the oil your Meibomian glands produce, has a specific melting point. In healthy glands, it flows out at normal body temperature, smooth and clear. But when MGD develops, that oil thickens. It becomes viscous and waxy, like butter that has been left to harden in the cold. At that point, the gland cannot squeeze it out. The oil sits stagnant inside, slowly causing the gland to swell, inflame, and in advanced cases, begin to permanently atrophy. Here's what makes this urgent. The window to reverse this is while the glands are still blocked, but still alive. Blocked glands can be cleared. Atrophy glands cannot be recovered. This is why how soon you act matters. Under the most clinically validated home treatment for unblocking those glands and restoring the oil layer is the application of sustained, consistent warmth to the eyelids, followed immediately by gentle physical expression. Here is why it works. When you apply heat at around 40 to 45 degrees Celsius and hold it steadily against your closed eyelids for 4 to 5 uninterrupted minutes, that thickened, waxy oil warms up and becomes fluid again. The viscosity drops, the gland can now be expressed. A study published in Cornea demonstrated that a single warm compress application significantly increased tear film lipid layer thickness and improved Meibomian gland expression scores in participants. Follow-up research confirmed that consistent nightly use over 4 weeks produces measurable improvements in tear film stability, reduced evaporation rates, and significant relief in dry eye symptoms. This is not anecdote. This is measured, repeatable physiology. But here's the critical mistake that causes most people to try this and give up. A standard washcloth soaked in hot tap water cools down to room temperature in under 90 seconds. You press it to your eyes, it feels warm for a moment, and then it's just a damp cloth. Doing nothing, the oil inside the glands never reaches the temperature needed to fully mobilize. The treatment fails, not because the principle is wrong, but because the delivery is too brief and too cold. The correct tool is a microwavable eyelid warming mask, a mask specifically designed to hold heat evenly for the full duration needed. These are widely available. They cost very little, heated for 15 to 20 seconds depending on wattage. Always test on your inner wrist first. It should feel warm but never uncomfortably hot, then placed over closed eyes while you lie still, and let the heat penetrate all the way through the lid tissue to the glands underneath. That sustained 4 to 5 minutes is the non-negotiable variable. It is the difference between a treatment that produces real gland expression and one that produces nothing. Immediately after the heat, while the oil is still warm and mobile, comes step 2, eyelid massage. With clean hands and your fingertip, apply gentle but firm rolling pressure along the lash line of the lower eyelid, moving from the outer corner toward the inner corner. In slow, deliberate strokes. Then repeat along the upper eyelid from inner corner to outer corner. 30 seconds per eyelid is sufficient. What this does is physically express the now fluid meibum out of the glands and into the tear film where it belongs. Without this step, the heated oil simply cools back down inside the gland and re-solidifies. The heat mobilizes the oil, the massage delivers it together, done in immediate sequence. They form what clinicians call warm compress therapy with expression. In controlled studies, the heat and expression group showed significantly greater improvements across every measured marker of tear film health, not comparable results, significantly greater. Step 3 completes the ritual. It takes 90 seconds. It's called lid hygiene. Immediately after the massage, using a pre-moistened eyelid wipe, or a cotton swab with a small amount of diluted baby shampoo, clean gently along the lash line of each eyelid. What you're removing is something called biofilm, a thin layer of bacterial debris and dead cells that accumulates along the lid margin and acts as a chronic source of low-grade inflammation directly at the gland openings. Think of it the way you think of plaque on teeth. You cannot see it. It builds quietly every day, and if you don't remove it, it gradually narrows the gland orifices, worsens inflammation, and undermines everything else you're doing. Lid hygiene costs you 90 seconds, and many people who add this step notice a difference in their mornings within the first week. Now let's talk about what is silently working against you, because doing this ritual and then making these mistakes is like filling a bucket with a hole in the bottom. The first mistake is screen use in the 30 to 60 minutes before bed. When you stare at a screen, your blink rate drops by more than 50%. From a healthy 15 to 20 blinks per minute to as few as 4 to 6. Every blink is how the Meibomian glands express oil. Every blink is how the tear film is refreshed. Halve your blink rate for 2 hours before sleep, and you are actively starving the tear film of oil at exactly the time when it needs to be at its best. The bedtime ritual should be the last meaningful thing your eyes do. Let them go into sleep with a clean, oil-rich tear film, not a depleted, over-evaporated one. The second mistake is rubbing your eyes. It feels satisfying in the moment, but sustained rubbing physically deforms the Meibomian gland architecture over time and introduces bacteria from your hands into an already inflamed lid environment. The urge to rub is not a signal to rub. It is a signal that your tear film is breaking down. The correct response is a single drop of a lipid-containing artificial tear, one that contains an oil or lipid component, often labeled advanced formula or long-lasting. It temporarily restores the outer seal, stabilizes the water layer underneath, and relieves the irritation without any of the structural damage. Powerful version of the same biology. Start with the foundation. Give it 4 weeks of consistent nightly effort. Heat, massage, hygiene, every night without exception. The glands that are blocked will begin to clear. The oil layer will thicken, the tear film will stabilize, and the burning, the redness, the morning discomfort, it begins to ease. One more addition worth discussing, because the research behind it is substantial. Omega-3 fatty acids, specifically EPA and DHA from fish oil, have been shown in multiple peer-reviewed trials to reduce meibomian gland inflammation and improve the quality of meibomian secretion. A landmark study published in the American Journal of Clinical Nutrition found a significant inverse association between omega-3 intake and dry eye prevalence. A separate randomized controlled trial found that participants supplementing with concentrated omega-3 showed significant improvements in Meibomian gland function scores and tear film stability compared to placebo. The mechanism is direct. Omega-3s are anti-inflammatory at the cellular level. They change the biochemical environment inside the gland. The typical dose used in dry eye research is approximately 2 grams of combined EPA and DHA daily. Fatty fish, salmon, mackerel, sardines are the best food sources. If your diet doesn't include these regularly, a high-quality triglyceride-form fish oil supplement is a well-studied, straightforward alternative. Now, for the most important detail about when this ritual must happen at night, because timing is not arbitrary. Your Meibomian glands accumulate thickened oil throughout the day. With every partial blink and every hour of screen exposure, by evening, they are at their most congested. Treating them at night, clearing that congestion before sleep, means their glands enter the overnight period open and functional. During sleep, your eye produces a lower demand but more sustained baseline tear film. Going to sleep with open, freshly expressed glands means the lipid layer reconstitutes properly during the night. You wake up with a meaningfully better tear film. That specific morning experience, the crusty, stiff, burning eyes at first light, is almost entirely the result of gland dysfunction compounding across the night. Address the glands before sleep, and that morning experience begins to change. Most people who are consistent notice a difference in their mornings before they notice anything during the day. Here is the most important thing I want you to hold on to. Your eyes are not broken. Your glands, in the overwhelming majority of cases, are not permanently failed. They are blocked, they are inflamed, they are neglected. The medical system offers significant in-office interventions for this: LiPi-flow, thermal pulsation, intense pulsed light therapy, and in-clinic gland expression. These treatments work, but every one of them operates on the same fundamental principle as the ritual I've just described: sustained heat to the lid tissue, followed by mechanical expression of the gland contents in a clean lid environment. The clinical devices do a more controlled, not because something was added from the outside, but because something your eyes were always designed to produce has been restored from the inside. If you found this valuable, if it finally gave you a clear explanation for what has been happening in your eyes, and what to actually do about it, then there is a great deal more of this on this channel. Real mechanisms, real solutions, the kind of information that lets you make decisions based on understanding, not guesswork. Subscribe to Dr. Thomas Ellison right now so you never miss a video. And if you have a family member or a friend who has been suffering with dry, burning eyes and getting nowhere with drops, share this with them. It may be exactly what they needed to hear.